And all right, we are live in the meeting. So whenever, or live on YouTube, so I can turn on sound whenever. Are we all ready for that?
Dr. Chen, are you ready?
I'm all set.
Okay, I'll welcome you. All right, we're ready, Tyler.
All right.
Tyler, I hear it's either from you or Dr. Chen. I hear background noise.
Okay.
You know, it might be me. Let me see if I can swap over to my headset here.
All right, and I am muted, and we are live on YouTube now.
All right. So thank you, Eatonville community, for turning out for our community discussion with Dr. Chen this evening, this afternoon, I guess, evening. On November 30th, Dr. Chen is the Pierce County Department of Health head chair, and we are so happy. Today finishes our first day of our testing pilot through the Tacoma Pierce County Health Department. We have the opportunity as Eatonville School District to be part of this pilot program that involves weekly COVID rapid antigen testing for any student or staff who are interested. And Dr. Chen, we kicked off at Weyerhaeuser and Eatonville Middle School today, and we're very, very happy about the results. And so we are very happy to have you this evening. I do have some questions at the end of your presentation, but I know that you have a very full presentation for our community members to really understand what it is that we are partnering with you and the outcomes that we hope for. So thank you so much for attending this evening.
Great. Thank you, Superintendent Barr. I just want to make sure that I'm sounding okay. I just switched between my microphones there.
You sound fantastic.
Okay, great. Thank you. First, we're just going to do some introductions. I'm Anthony Chen. I'm Director of Health of the Tacoma Pierce County Health Department. Today, with me, you'll see there's also Dale Phelps. Dale, if you could give a wave. Dale is our communications person for COVID-19. Looks like you can't see Lori Carnes, but Lori is one of the key people working on the school's testing pilot, but normally she does school inspections, very familiar with all of your schools. And then Jennifer Thompson is one of our project managers, key project managers on this as well. Normally Morgan Black is with us, but I don't think she's able to join us today. So with that, let me switch over, and I'm going to make sure I get to the right window here. For some reason, Google does not want to let me share my screen.
Dr. Chen, does it allow you to click present now if you hover near the bottom? It should pop up with that option near the bottom right-hand side.
Yeah, it says present now, and then it says, will you allow me, Google, to see your screen? And it doesn't allow me to click on the allow button. So
sometimes you have to click the option to allow it to show your full screen, which is kind of near the center.
Hang on a second. Okay, I'm sorry. They're working on so many different platforms. I see what it is. It's asking me which screen, but it gives me a list. So give me 1 second as I work through my list here. Hang on a second. here we go. All right. Okay, can you guys see the presentation now?
Yes, we can. That looks perfect.
Okay, great. So here we go. All right, so we just did introductions, and then we're going to cover a bit about why we should be testing children and teachers for COVID-19. We're going to go over the testing plan, timeline, and process in your district, and you've already heard from the superintendent that some of this is in progress very much as we speak, and then we'll try and allow as much time for questions as possible. Um, why have a testing program in schools? I think any of you who either have children in college or have friends who have children in college know that colleges, many colleges are doing testing. Professional sports teams are also using using testing as a way to try and identify positive cases, safely isolate them to minimize further disease spread. And that's how, you know, we can still see the Seahawks, and we can still see UW playing because it's an added layer of protection for them, and to try to break the cycle of transmission here. So we're using this opportunity to offer the same these set of resources to some of the schools in our county. Also want to let you know that we're not the only county, we're not the only school districts talking about this. Schools across the state are developing models. And in fact, as we were developing this, we were in conversations with the State Department of Health, who's working to bring on some schools in January with some kind of pilot program. The difference is that as a Pierce County pilot participant, your district gets a head start on school-based testing. The Department of Health is actually very interested in what we're doing because we are out of the blocks first. There's going to be a lot we're going to learn about what's feasible, and also looking at the data that we find will help us move forward with this. So in terms of coming back to what I said, it is very important for us, especially when we don't have a vaccine, we don't have a cure for COVID-19, we have to use public health measures. And one of the very key strategies we use in public health is identify cases as quickly as possible, isolate the people who are sick, find out from them through case investigation, contact tracing, who might have been in contact with them, get those people quarantined so that we're, again, breaking the cycle of transmission. We're not letting people get other people sick. This is a critical strategy in our COVID-19 response. This is especially important because we are learning that COVID-19, like many other illnesses, people can be sick but not have symptoms. And even people who develop symptoms, often they will be infectious for a few days before they start showing symptoms, and therefore, may be spreading infection and not know it. And in order to identify positive cases, we need to test people. In children especially, children tend to show very few symptoms. They're often what we call asymptomatic, or have very mild illnesses. And so any of the statistics you read now about the rates of infections in school-age children is probably an underestimate. Now this shifts towards middle school and high school. The children start acting more like adults. As we were looking at this pilot, we looked at different models. There are different tests that can be used. There are different frequency of testing. And what we chose is we're going to be using something called an antigen test. And we selected a model where we test weekly. So to me, this was a really exciting opportunity for us because, as you know, this whole issue about whether children should be in school learning in person or not has become, a source of great concern and anxiety, in different ways. We have heard from parents and educators that the educational, social, and emotional needs of our children are very important, and that learning doesn't work as well remotely as in person. And it is especially challenging for the youngest learners and those with special needs. At the same time, we've also heard school staff and parents talk about how concerned they are about health and safety. And of course, for the health department, our concern is that we are, I mean, right now we're seeing increasing cases. We're into our third surge of cases. We want to be able to quickly identify those positive with COVID-19 to prevent further disease spread among the school population and beyond. We want to make sure that the high levels of community transmission going on right now are not creeping into schools. They already are, but we want to make sure that it's not a large, number of cases in school. At the same time, you can imagine the number of kids moving around, going to school, and their parents maybe taking them to school, that there's more community movement and interaction, and we know those are things that could spread COVID-19. And we were very hopeful at the health department when we thought that testing, a good testing program in school might be a way for us to address all three of these concerns without asking one particular group of constituents to make more compromises about what their concerns were. So our goals in doing a testing pilot are students' physical, mental, and emotional health, the safety of staff and students for a safe in-person learning environment to reduce transmission to community, and increase access to testing in areas with fewer testing options. And so with an equity lens on, when we were trying to decide which school districts we wanted to offer this to, we chose to offer this to our smaller, more rural school districts on both ends of our county, because we know that access to testing in those areas is particularly challenging. So our plan is, and what you're taking part of today, is to educate the public about the importance of testing. There will be some testing in the school community before beginning in-person learning. Students and staff will receive a COVID-19 test once a week. We will hopefully quickly identify and isolate any positive cases and quarantine their close contacts. We will continuously be checking on our results to monitor progress, and then we'll evaluate the program during the holiday break, and then see how we will move on, and certainly share that information with your community as well as the Department of Health as they look to expand this program in other parts of the state. So as I mentioned, we've offered this to our smaller rural school districts. The participating school districts are your school district, Eatonville, as well as White River and Peninsula School District. The Tacoma-Pierce County Health Department and the Pierce County Department of Emergency Management are key partners, of course, in supporting the incredible logistics that go into this plan. And I'm just going to run through a little bit here about what you can expect as parents and community members and staff members. Okay, I'm getting a message that my PowerPoint is not proceeding. Dale, can you see, I'm on the what to expect slide. Is that what you all are seeing as well?
No, we're on slide 1.
Oh, you mean I've been talking all along and you guys haven't been seeing what I've been talking? Hey, what about this, Dale? I wonder if I've got bad bandwidth or something. If I stop presenting, do you have the presentation?
I do. I'll give that a go.
Okay, great. I'm going to stop right now, and then maybe we can just walk through from the beginning till we get to this slide.
I'm always worried that it's my own machine, so thank you for seeing that in the chat.
No, that's okay. This is a beef I have with Comcast. It's like every day I get at least once a message about my internet is unstable, and heck, I live in downtown Tacoma. It's like if they can't get downtown Tacoma right, I don't know how they get Eatonville right, you know.
Well, trees don't do well with.
Great, thank you, Dale. So why don't you just go on to the next slide? Actually, let's just kind of slowly walk through them because people get a chance to see them. So we kind of run through this already. This is the agenda. Next slide, please, Dale. I think you heard me kind of walk through why we have a testing program in schools. Next slide, Dale. And here's the further reason program in schools. And I think the main point is we looked at different models and we're doing a weekly testing model. Next slide, Dale. These were the 3 areas of concern and the 3 constituents that you heard me talk about. And our objective is to try to balance their needs and concerns and achieve a win-win-win using a school testing program. Next slide, Dale. Here are the goals you heard me run through. I'm personally a visual learner, so it helps for me to be able to read. So hopefully you guys get a chance to read it now. Next slide, Dale. Here's what you heard me describe about the plan, and we're now kind of moving through this as well. And you heard me say that we're going to continually monitor the progress of this and evaluate the program during the holiday break. Next slide, Dan. Here are the participants in addition to your school district, the other 2 school districts, as well as the health department and Department of Emergency Management. Next slide, Dale. Okay, great. So this is where I got up to, and you can see in this diagram that when the student arrives at school, as they normally would, they would be screened for symptoms of COVID-19. They go to class and begin their day. The teachers will then receive an alert to bring the class to a testing site. They confirm that the students have consent forms. They walk with the students to the testing site and instruct them to line up in a physically distanced way. And then they check in with registration, where again, the name and date of birth is confirmed. Then the swabber confirms the student's name and date of birth, asks for verbal consent, and then does the nasal swab. When they're done, the student will walk to the exit where the navigator helps them back to class. Next slide, Dale. And you can see this is just kind of a schematic of the what the room layout might be. You can see the students will come in from the lower left. There'll be multiple stations set up. They go through registration, then they pass to the swabbing station where the nose is swabbed. And then when they're done, they exit to the upper left. And then the swab itself is passed on to the processor. Lori, I was going to check. Do you have your demo kit with you today?
I do have it today.
Okay, so I'm going to pass it to Lori. And Lori, maybe you can just walk us through, people can see what is going to be involved.
Sure. So today was actually our first day at Eatonville. So we were at Weyerhaeuser Elementary as well as Eatonville Middle School today. Did a handful, or not really a handful, more than a handful of tests on students and staff. And so I'll just kind of walk you through the process so you can see what we did for them today. So there is a swab that our swabber has, and that swab looks like this. So it's about a 6-inch swab, but not nearly all of that goes in your nose, just the very tip of it. And this is just like a cotton swab, and it's not the back to your brain swab or anything. It's an anterior nasal swab. So less than 1 inch actually goes in each nostril. So the swabber will put it in each nostril, swirl 5 times. Over the age of 18, you can swab yourself if you prefer. So once that is completed, the swabber has a little test card. So this is what the antigen test looks like. And you'll see that there are 2 little, well, right now there's 1 little line. It's a little blue line, and that is for the control. So when it comes out of the package, it is a blue line, meaning that the test has not yet been processed. So the swabber will add, this card opens up. So when the swabber is ready to start the test, they add a little reagent and it goes in this test well. So they'll add 6 drops of a reagent, and then they take this swab and they basically insert it into that bottom hole, into that top hole, and then they turn it 3 times. Once they do that, they remove this little adhesive strip, close the test kit up, and then the stopwatch starts. So as 15 minutes progresses, this little blue line will turn pink. If there's only one line, so only one pink line appears, that means the test is negative. But if there's two pink lines that appear, that means it's positive. So the test takes 15 minutes. If we do have a positive result, we ask the district to reach out to that person, and they return for PCR testing to confirm that positive test result. But essentially, that's all it is, just a little card, a swab, and some reagent, and as easy as that. So that's what we were doing today at Eatonville Middle School and Weyerhaeuser, and we will be at Columbia Crest and Weyerhaeuser Middle School as well tomorrow.
Great, thank you, Lori. Dale, can you bring your screen back up? So you heard Lori mention a couple things. We are using the antigen test. The advantage of that is it is rapid. We can do it there on site in 15 minutes if it's positive. And there are some weaknesses of the antigen test. We know sometimes it can have a false positive test. And so because we will have a result in 15 minutes, we can have the child come back or the staff member for that matter. They can come back and we can get them tested with a more accurate test, which is what's called the PCR test. Next slide, please, Dan. So here's the timeline. You can see we've already moved past some of the dates on here, and we're now on that third bullet. The school-based testing will begin today, November 30th. We will continue this weekly, and then the pilot will end at the holiday break. And as I mentioned earlier, we'll evaluate the pilot and work with the school district on next steps for January. Next slide, please. So with that, we are, Dale, thank you. Let's get off of that. And Superintendent Barr, I understand we already have some questions. So why don't we get started with that?
All right, we do. You know, one thing, Dr. Chen and Lori, I just want to say thank you so much for today. Your staff was amazing, made people feel very at home. I myself got tested this morning, and I didn't get a phone call or an email, so I am negative, so that makes me feel good. I do hope that our community finds that this is really an asset. One thing that we are hybrid, or I'm sorry, we are remote for the next 3 weeks. We really want to encourage our families to be able to come into our sites at no cost and to be able to access this testing, because prior to this, Dr. Chen, we had very little options. I know that we did have the Pierce County Health Department and Emergency Management System on the weekends, but this will be at least 4 days a week that we will be serving the community and our school community. So I just wanted to make it really clear, Lori, that we don't have signups. We have drop-ins, and if they came today, they saw that there was plenty of staff to take care of their needs. And we just want our families to feel confident and comfortable coming in. So are you ready for the questions, Dr. Chen?
Sure am.
All right. So this question says, I'd like my first grader to be tested as frequently as possible. But after getting a nasal swab test at a mobile clinic last weekend, he was a bit upset, and I'm not sure he will want to be tested again. Assuming I'm not with him, how will you administer the test to children who may be afraid or not want the test?
I think that's a great question. I think many parents will be concerned about that. You know, we will not force any children to get tested. I think, you know, the staff, both from the school as well as the staff who are conducting the tests, they're really good about setting people at ease. I think probably very similar to if any of you have been to the doctor and you need to get a blood test, right? The people who draw your blood, they know some people are scared of needles, you know, so they tend to have their ways of setting people at ease. One of the ways that I think parents can really help with this is, you know, talk it up. I mean, you know, and there are ways that you can be positive about it. You can, you know, I can remember when my son, he's 30 now, right? But, you know, there's sometimes these kids come home, it's like, oh, I hate my teacher, I don't want to go to school, or, you know, some kids bothering me at school. And if we talk through with them and we can, you know, reorient them in a positive way, it really helps. And as I said, the staff who are doing this are very skilled at working with kids, setting them at ease. And again, we will not force any kid to get tested if the child's having a bad day, or we will let them go. And we're here really to get as many tests as possible. And we know that some it just wouldn't work out for some.
So Dr. Chen, if I'm a mom and I have that child, is that okay if I bring him in? Of course, I need to give the paper, but can I also go and sit with him while he gets tested? Is that a possibility?
That's something I would encourage you to talk with the school and the teachers about. I know that sometimes having a parent present actually increases the anxiety of the kid.
Yeah.
I mean, I learned this like way back when my son was in preschool, where he went to a Montessori and they said, okay, parents, you drop your kids off in the alley and leave.
Yeah.
Because if you linger, they just cling to you and then they get more stressed out. So that's something I encourage you to talk about with the school staff. They understand that much better.
Okay. So this question says, won't testing bring everyone into the same location, same testers? Are they changing gloves each time, sanitizing, put people at risk of being exposed to the virus? So it sounds.
Oh, absolutely. I mean, let me have Lori answer that. I mean, everyone's very aware of hygiene and protection right now. So Lori, you want to address that?
Sure. So in between having people be tested, our swabbers, they do change gloves, they do disinfect the area, so they spray down the chair and their workstation with an EPA approved list and disinfectant against COVID-19. So we are, taking this very seriously, and we want to be the last people to have a COVID case in a school or from our testing location. So this is something that is on our minds at all times. And our staff is also wearing the appropriate PPE. So our swabbers are wearing KN95, so the face shield, gown, and gloves being changed each time.
Thank you, Lori. So in this question, are all students required to test for COVID? Are they testing in order to come back to school? And then does this cost money?
Well, that's several questions there. And let me kind of work backwards through that. So does it cost money? Does not cost the parents any money. And right now it's not costing the school any money other than the staff time that they're investing in this. We were fortunate enough to be able to get CARES funding for it. We've also purchased test kits that hopefully, if we can continue this into January, we should have some test kits available for that, but no cost at all to the parents on this. And are we testing in order to come back to school? If you remember, I said there are kind of these three concerns we have. We want to try to get kids back in school, or more kids back in school, for in-person learning. But at the same time, we want to make sure it is we're taking precautions to safeguard health and safety, as well as precautions to reduce spread in the community. So that's the idea, and I hope that everyone will lean into it. I know that the superintendent and her staff are leaning into it. Our health department staff are leaning into it. I really hope that parents will lean into this and try to get us as much information as possible between now and the holiday breaks, so that we get an idea about how much disease there is in the community, how many asymptomatic kids there are, and try to show that we're not, having big outbreaks in school. And so that's kind of gets at the question, are all students required? It really would be helpful for us to have as many students participate as possible. And I can get into more detail about that later, but I think that covers the three parts of that question.
So this question really talks about the asymptomatic, and this is, I'd like to make it clear to the community that we are talking about when you don't have symptoms, right? So this question, this type of testing has been compared to sports, NFL, college, etc., but they test daily. Please explain a weekly test compared to daily testing and perhaps the benefit of each.
Yeah, so, for one thing, I wish we had as much money as the NFL did, right? Very intensive what they're doing, but at the same time, I mean, when they're doing physical contact in their games, they're not wearing masks, and so the benefit of what you have in schools is that the schools are all following very good precautions laid out by Department of Health and OSPI regarding masks and physical distance and so on and so forth. Hopefully the kids aren't tackling each other and wrestling in the hallways, right? So um, the risk for kids is lower. Also, as I said, we know kids tend to get sick less. Unfortunately, they also tend to show symptoms less. We did talk about everything from testing twice a week, which is what colleges are doing once or twice a week, the ones that are testing. There are some schools, and unfortunately, not a whole lot of standardized procedures on this. As I said, you guys are some of the first out of the blocks on this. There's some places, I think New York, where they're testing every 2 weeks. And it turns out that if you test every week, this works out really well in terms of the technology. The key time that we want to be testing people are, if you count day one as the day that they got infected, um, around 5 to 10 days is when they're most infectious. Okay, and we want to catch them at that time from a public health standpoint, because we don't want them spreading it to other people. Now, they might not be symptomatic until a little bit later than day 5, but starting day 5, day 10, that's the key time. We know that the antigen test is not quite as sensitive. It might be half a day later than the PCR test, but the PCR test can take 2 days to come back. It's what Lori was talking about, is that swab that tends to go all the way into the back of the nose. And then the antigen test is probably will continue to stay positive through the 10 to 14 day window. So it covers that for some time afterwards. And then it becomes negative. The PCR test will continue to stay positive for much longer. It's helpful for us to know with a PCR test if someone was ever infected, right? But in our case, what we're trying to do is make sure that kids are not, and staff are not infectious when they're in school. So you can see on a once weekly basis, if we're looking at a 5 to 10 day window, where they're infectious, we'll catch them on one end or the other, right? So either we'll catch them early in that 5 to 10 day window, or we'll catch them on the end of that. So it turns out a weekly is probably the best bang for our buck, especially for the resources that we're dealing with. So unlike the Seahawks, they come in all the same time, right? Your kids are coming in on this kind of hybrid split cohort model. And it's just for one class, we're going to have to test them, at least twice, is it, Superintendent Barry? Because they're split up into smaller groups. So it just logistically could be a nightmare if we try to test too often. And actually, again, Department of Health is very interested in this, because they want to see if the logistics of this will work. Can we successfully pull this off in multiple schools and in several different school districts? But we think this will cover us for exactly what we need to do here.
Okay, thank you. So let's see. This question is it possible to set up the testing site in a tent outside so a parent can be present? And so, so I will speak, Lori. I know that we did have families that came in today. Could you speak to if a mom brought in a student inside the building, what that looked like today?
Yeah, so today, because it was kind of a drop-in setup, obviously your 7-year-old can't walk in by themselves. They need their parent guardian to get them into the building, because their teachers in there. So yeah, we did have parents come in, siblings sometimes came in, and they just kind of waited on the sidelines while the child went through the process. So if there does need to be a parent present, I think that's perfectly acceptable.
Yeah, one of the differences is that we are in a remote setting, so parents are actually making the commitment to come in and get their child tested. And so that does change that, at least for the next 3 weeks. That's the format that we're in right now. And so we do encourage that families come in or parents bring their children in. Can you explain, let's see, can you explain the purpose of the testing when students are currently in remote learning? I know that that has been a big question for families.
Right, so the idea here is to help us set up a system that gives us an extra layer of safety and mitigation so that we can bring more kids back for in-person learning. You know, as you heard me say earlier, I think we all believe that in-person learning is more effective, and especially for those who are younger or might have learning disabilities or developmental disabilities, then, you know, if we can find a system that is safer, that reassures us, then allows us to bring more kids back into in-person learning. And again, this coming back to the question about how, you know, do all kids need to be tested? Right now, it's really helpful for us to have as many kids, as close to 90, 100% tested as possible. Same with staff, because we want to know. I mean, if only 25% of the kids are getting tested, I have no idea what the other 75% are doing. Sometimes we'll do that in a scientific way. We will, you know, statistically select which 25% get tested. But here we're not able to do that. If we have less than half, it's really hard for me to say. But it would be great information for us to know, like, hey, only 10% of kids are coming in positive versus 40%, 50% of kids are coming positive. But then we also want to know, are those positives transmitting it to anyone else? And if it's not transmitting, that's also good information. So especially now, we need as much information as possible.
So one of the conversations that you and I have had, Dr. Chen, is, you know, in Eatonville, I guess I was postulating back to you to say our numbers are not as large as the rest of Pierce County. But really, when it came down to it, we didn't have really the testing capability that other areas did. So we really did not know. And so we do believe, because we were open K-5 for over a month, that our numbers were low because we did not have any positives at that time with our staff or our students. But this gives you information and data, more information than we currently have or that we had before.
That's correct, Superintendent. So Eatonville testing rate is much lower than the county average, and it's the lowest among the 3 school districts that we're doing. So this gives us a lot of information, and, you know, we're glad that we're able to provide services to your area.
Yes, we feel very fortunate. Okay, you've answered that one. My children were tested today, but we never received an email or phone call about the results. How long is it supposed to take? And if we don't hear anything, do we make the assumption that it's negative? Maybe Lori, you and Dr. Chen, you could talk about what people can expect when they come in.
Lori?
Yeah, I can talk a little bit about the process. So today was our first real day launching all of our test sites. So we're still kind of working on the database and getting that set up, but the intent is to have an email sent out same day, or maybe at the latest the next day with a negative result. If for whatever reason someone does test positive, they will get a phone call within that hour. So we alert the district, who then the district reaches out to that person and calls them to come back to receive a PCR test, and that will kind of confirm that antigen test result. So if you did not receive a phone call today, you are safe to assume that you are negative.
Thank you, Lori. I'm going to take that because I did not receive a phone call.
Good.
And, you know, I have to say, peace of mind. I actually was very excited last night and this morning to be able to come in and then have the ability to have an antigen test. That's a big thing. I mean, that really does. It's not a cure and it's not a vaccine, but it's better than the unknown. And so thank you for that. I just had to say that. That wasn't on the list here. I have one more question, Dr. Chen. I turned in the paperwork when the children were tested. Do I need new paperwork every time if we get tested each week, or is that kept on file?
So that paperwork will be kept on file. So the consent and registration form, if you read it, I believe it says it gives permission to test for the month of December. So the next time a staff member or child returns, they should just need to give their name and their date of birth to the registration table, and then we can look that up in the database, make sure we have their consent and registration on file, and then they would proceed as they did today.
Okay. And so if I went to Weyerhaeuser today and next week I want to go to the middle school, does that change that answer?
That does not change that answer.
Perfect. Okay. All right. We've gotten to the end of my questions. Dr. Chen and Lori and Dale, you did really well. Thank you. Is there any closing remarks? We feel very fortunate, I do have to say. Thank you for selecting us and allowing us to be part of the pilot. In the absence of that, we really had very little testing before we started working together. And I know that our local pharmacist is also working to be able to be a symptomatic confirmer tester. But that I confirmed with Kirk Hines today that that's a couple weeks out. So I did want to thank you very much.
Yeah, Superintendent Barr, we're so excited to be able to work with you and your staff on this. As I said, when we thought about this, we thought it was a really good way for us to address, those three concerns, the different constituents. What you hear a lot now is we're making empirical decisions, right? You'll hear people say, well, we think that children spread it less. We think, it's not a severe illness. Therefore, it's more important for us to get the kids back in-person learning. And having this program allows us to, again, add an extra layer of safety and get information and confirm. I mean, if we are able to confirm that that is a correct assumption, then it allows us to move forward more. Of course, we're hoping that we will be able to get resources to continue this into January, but we will keep you and your community updated on what our findings are. And both in terms of the results as well as in the process about whether we need to tweak that.
So New York School District made an announcement, was it yesterday, that they were going to reopen and that they were going to institute antigen testing as well and increase that. Could you speak? I know this, I'm just asking you. Could you speak to, because that's thousands and thousands of children coming back to school with testing as an added bonus. Could you speak to what your hope maybe in the future might be for us to successfully reopen in a safe manner?
Yeah, so what you're referring to is that New York, New York was a site of one of the worst outbreaks, right? And then they were able to control it very well. They felt it was safe for them to reopen their schools with a testing program. Unfortunately, and we looked at that as one of the models. Unfortunately, it turned out that the participation was quite low on that. And then when cases went up again, they closed schools again. So, and as you mentioned, now they're talking about reopening again. So, what we're hoping here is one of several things. If we find some information that is very insightful, as I mentioned earlier, for example, very few cases are being brought into schools, or, cases are coming into schools, because people are getting them from outside the school setting. But once they come to school, we're not finding any further spread to other students or staff. That's good information too, for us to know, and it will help inform as we move forward. And then, our hope is that if the resources are there and maybe the findings aren't so clear cut, but it does allow us to continue to monitor, and then it will be very helpful for us to see what happens as you open more classes up to in-person learning, right? So again, this is a strategy for us to try to help you get more kids in for in-person learning at the same time providing a layer of safety. So the testing that we're doing is actually more frequent than New York is doing. I believe they're doing every 2 weeks. I think some of the questions have pointed out the timing can be important. I think they feel that 2 weeks may be adequate. And then they're doing a sampling rather than, we're trying to aim for as high participation as possible. There are differences with New York, but the concept again is similar, that we want to get more kids back in person in as safe a way as possible.
Okay, thank you. So before we sign off, Allison, would you just review for our viewers where they can go and when?
Sure.
And what they need when they come?
Yeah, so if you have not submitted your consent form to us, that's okay. You can bring it to the testing locations with you, and they actually have extra copies on hand. So if you don't have a printer at home, that's no problem. Starting tomorrow, you can test at Columbia Crest here in Ashford every Tuesday from 9 a.m. to 3 p.m. And you do not need to make an appointment. Just come up to our front door and we'll walk you up through our gym onto our stage for testing. And then Eatonville Middle School is another testing site open tomorrow. And again, from 9 a.m. to 3 p.m. And then Thursday and Friday, Eatonville Middle School again this week. And then next week, Weyerhaeuser and Eatonville Middle School on Monday. And if you forget any of this, you can check out our website, or you can follow us on Facebook or Twitter for information as well.
Thank you. And Dale, I saw you had your hand up.
Yeah, I was just going to say one thing, and some of it, I guess, kind of duplicates what Allison just said, but we have a website with a lot of questions and answers on the health department website, and I'm sure you've probably shared out that link. And then today we added, we've had an English language consent form on there, but today we added Spanish and Russian versions, so perhaps some of your constituents might need that. So that page keeps growing with information. And if anybody who's listening to this, when we ring off here and you think, oh, I wish I'd have asked that, you could probably funnel those questions back to Allison, because we meet weekly, and we'll get them answered directly to you or part of our FAQ.
Yeah, thank you for saying that, Dale. I was just going to add, if you would like to email us directly, please use our communications.
He has pasted the link to the webpage that Dale was referring to.
And I will drop that in our YouTube chat right now for our viewers.
Okay. Well, thank you. Thank you for joining us this evening, and thank you for partnering with us. We feel very fortunate, and we hope that our community reaches out and brings their children in, and that we can get additional testing and additional support. So thank you all. Have a good evening.
Great. Thank you.
Bye-bye.
Bye.